This video is about a very commonly asked question in ENT practical exams, especially in the OSCE format, the new regulation of exams that has been introduced fairly recently. One of the most commonly asked OSCE stations in ENT practical exam is perform the motor function test of facial nerve. It's a very simple test. You just need to know exactly what you need to tell the patient. You will be observed how you perform the test, and of course every clinical examination should start with you introducing yourself, greeting the patient, confirming the identity of the patient, understanding which language the patient is most comfortable in, finding a language that you can both communicate in, a common language, and then explaining the test you are about to perform in simple words in a language the patient understands. Then you should obtain consent to perform the test, and then you should perform the test. In this case, the task is perform the test to assess motor function of facial nerve. Facial nerve provides motor supply to the muscles of facial expression. There are some other muscles also which the facial nerve supplies, but here we are only going to test the muscles of facial expression. Let us understand what we should tell the patient. First thing we tell the patient is act surprised, and we will look at the wrinkling of the forehead. Next thing we ask the patient is frown, and we see the eyebrow muscle, corrugator supercilii. The wrinkling muscle in forehead is the frontal belly of occipital frontalis. The next muscle group we check is the orbicularis oculi. We ask the patient to close the eye and not allow us to open the eye, both sides. Next muscle group, buccinator. We ask the patient to puff their cheeks and not let air leak if we tap on their cheeks, like that. Next up, we ask the patient to whistle, except don't make the sound, like this. This tests the function of the muscle orbicularis oris. After this, we ask the patient to smile. A group of muscles are tested in this situation: levator anguli oris, depressor anguli oris, zygomaticus major, and risorius. And finally, we ask the patient to smile with clenched teeth, and we see the contraction of the platysma, which is supplied by the cervical branch of the facial nerve. I hope you like this video. This is how you should perform the test to assess motor function of facial nerve.